Have you ever stopped to wonder about the true importance of your lungs? This vital organ, tucked away inside our chest, play a pivotal role in keeping us alive and well. The lungs are our body's lifeline, responsible for the essential task of respiration. They draw in oxygen from the air, which our body needs for energy, and expel carbon dioxide, a waste product of our cells' metabolic processes. Imagine your lungs as a pair of bellows, inflating and deflating with each breath, working tirelessly day and night. These organs consist of delicate, spongy tissue divided into sections called lobes. The right lung has 3 lobes, while the left has 2, making room for the heart. The journey of a breath begins with the air entering through the nose or mouth, traveling down the trachea, which splits into 2 tubes called bronchi, one for each lung. The bronchi further divide into smaller branches, leading to millions of tiny air sacs called alveoli. It is here in these microscopic sacs that the magic happens. Oxygen from the air we breathe passes through the thin walls of the alveoli into the surrounding blood vessels, while carbon dioxide, a waste product, diffuses from the blood into the alveoli to be exhaled. Our lungs do more than just facilitate respiration. They filter out small blood clots, microbes, and other debris from the bloodstream. They also produce a substance called surfactant that keeps the tiny air sacs in our lungs from collapsing. But what happens when our lungs don't function as they should? What if these intricate, highly efficient systems are compromised by disease? The impact can be far-reaching, affecting not only our respiratory system but also our heart, brain, and other organs that depend on the oxygen-rich blood supplied by our lungs. In the next sections, we'll delve into the world of restrictive and obstructive lung diseases, exploring their causes, effects, and management. Understanding these conditions is crucial because, as you can see, our lungs are indispensable to our health and well-being. So, stay tuned as we unravel the complexities of these lung diseases. Restrictive and obstructive lung diseases, 2 terms that sound complicated but really aren't. In fact, they're simply categories of conditions that affect how our lungs function. So, let's break it down a bit. First, we have restrictive lung diseases. Imagine your lungs as balloons. In a healthy state, they should be able to inflate and deflate fully. However, with restrictive diseases, something is preventing this full expansion. It could be because of stiffness in the lung tissue itself, as in the case of conditions like pulmonary fibrosis. Here, the lung tissue becomes thick and scarred over time, making it harder for the lungs to expand, or it could be due to abnormalities in the chest wall or muscles involved in breathing. For instance, conditions such as scoliosis can distort the chest wall, limiting lung expansion. Now let's move on to obstructive lung diseases. These are conditions that make it difficult for air to flow out of the lungs. Imagine trying to breathe through a straw that's pinched at one end. That's what it's like with obstructive diseases. Conditions like chronic bronchitis cause inflammation and excess mucus in the airways, narrowing them. Emphysema, on the other hand, damages the air sacs in the lungs, causing them to lose their elasticity. And then there's asthma, a condition where the airways become inflamed and narrow, especially in response to certain triggers. In essence, while restrictive diseases limit the lungs' ability to fully expand, obstructive diseases primarily hinder the flow of air. But remember, it's not always a clear-cut distinction. Some conditions can have elements of both restrictive and obstructive patterns. For example, in severe cases of obesity, excess weight can restrict lung expansion, but it can also cause obstruction due to increased pressure on the airways. Though these diseases have different causes, they both affect the functioning of our lungs in significant ways. While both restrictive and obstructive lung diseases disrupt our lung function, they do so in different ways. Let's dive into the nitty-gritty of how these conditions affect our lungs. Restrictive lung diseases primarily impact lung capacity, meaning they limit the amount of air our lungs can hold. These conditions, such as pulmonary fibrosis or chest wall abnormalities, make it difficult for the lungs to fully expand. This happens because of stiffness in the lungs or because of weakness in the muscles that help us breathe. Imagine trying to inflate a balloon that's been dipped in starch. It's going to be a lot harder to fill it up with air, right? That's similar to how restrictive lung diseases affect our lungs. In contrast, obstructive lung diseases are all about airflow. They primarily affect exhalation, the process of breathing out. Chronic bronchitis, emphysema, and asthma are examples of these conditions. Here, it's not about how much air the lungs can hold, but rather about how easily air can flow in and out. Picture this. You're trying to blow air through a thin straw. It's going to take more effort, and that's the struggle faced by those with obstructive lung diseases. But it's not just about inhaling and exhaling. Both restrictive and obstructive diseases can lead to decreased oxygen levels in the blood, impacting the rest of the body. They can cause fatigue, difficulty with physical exertion, and even affect the heart's function. It's like a domino effect. When one part of the respiratory system is compromised, it can have cascading impacts on the entire body. This interplay between different parts of our body underscores the importance of maintaining lung health and seeking timely medical attention for any respiratory symptoms. Each of these conditions presents unique challenges and requires distinct approaches to diagnosis and treatment. Understanding how they affect lung function is a crucial step towards effectively managing these diseases. So let's continue our journey to learn about the symptoms and diagnosis of these lung diseases in the next scene. Recognizing the symptoms of these lung diseases is the first step towards diagnosis and treatment. Both restrictive and obstructive lung diseases share some common symptoms. For instance, shortness of breath is a prominent symptom in both types of conditions. This happens because the lungs struggle to fully oxygenate the blood, leaving you feeling winded even after minimal physical exertion. Another common symptom is a persistent cough. In the case of restrictive diseases, this is often dry, whereas with obstructive diseases, it may be productive, meaning it brings up mucus or phlegm. Wheezing, a whistling sound when you breathe, is more typical of obstructive diseases as the airways become narrowed and inflamed. Other symptoms can include chest tightness, fatigue, and in severe cases, bluish lips or fingernails due to lack of oxygen. However, experiencing these symptoms does not automatically mean you have a lung disease. They can also be associated with other health conditions, which is why a proper diagnosis is critical. Diagnosis typically involves a combination of clinical history, physical examination, imaging studies like chest X-rays or CT scans, and pulmonary function tests. These tests measure how much air your lungs can hold, how quickly you can move air in and out of your lungs, and how well your lungs deliver oxygen to your bloodstream. For instance, a spirometry test measures how much air you can breathe out in 1 second and how much air you can forcefully exhale after taking a deep breath. This can help distinguish between restrictive and obstructive diseases, as each affects these measures differently. A bronchoscopy, where a doctor looks at your airways through a thin viewing instrument called a bronchoscope, may also be conducted to diagnose certain conditions. In some cases, a lung biopsy, where a small piece of lung tissue is removed for examination, may be necessary to confirm the diagnosis and determine the severity of the disease. Early detection is key, so never hesitate to seek medical attention if you're experiencing any of these symptoms. While there's no cure for restrictive or obstructive lung diseases, there are ways to manage their symptoms and slow their progression. Both types of lung diseases require a comprehensive approach to treatment and management, which often includes lifestyle modifications, medications, pulmonary rehabilitation, and regular checkups with healthcare professionals. Let's start with lifestyle modifications, which are crucial for managing both types of lung diseases. This usually involves quitting smoking in order to reduce lung damage, maintaining a healthy diet to support overall health and lung function, and engaging in regular physical activity to strengthen the lungs and improve circulation. Now, on to medications. For restrictive lung diseases, doctors often prescribe corticosteroids to reduce inflammation and fibrosis. On the other hand, for obstructive lung diseases, bronchodilators and inhaled steroids are typically utilized to help open up the airways and make breathing easier. Pulmonary rehabilitation is another effective treatment method for both restrictive and obstructive lung diseases. This is a customized program that includes exercises, education, and counseling to improve lung function and quality of life. It's designed to help patients better understand their condition, learn how to manage their symptoms, and stay active and independent. Last, but certainly not least, is the importance of regular healthcare checkups. Regular visits to healthcare professionals allow for the monitoring of disease progression and the adjustment of treatment plans as necessary. These checkups often involve lung function tests, imaging studies, and discussions about symptoms and overall health. In sum, the management of restrictive and obstructive lung diseases involves a multifaceted approach. It's not just about taking medications or making lifestyle changes, but rather a combination of treatments tailored to the individual's specific needs and condition. Living with a lung disease is challenging, but but with the right treatment and care, it's possible to maintain a high quality of life. Let's take a closer look at how these diseases affect our lungs. Picture your lungs as two balloons expanding and contracting with each breath you take. Now imagine one balloon gradually losing its elasticity, struggling to inflate fully. That's quite like what happens in restrictive lung diseases such as pulmonary fibrosis or chest wall abnormalities. The lungs are unable to expand fully, leading to a decrease in lung capacity. On the other hand, consider a balloon with a narrow opening, making it difficult to deflate completely. This illustrates obstructive lung diseases like chronic bronchitis, emphysema, or asthma, where the airflow is hindered, especially during exhalation. Let's bring these concepts to life with some real-world examples. Consider Mr. Smith, a 55-year-old gentleman who has been a smoker for the past 30 years. He complains of persistent coughing and difficulty in breathing, especially when he tries to exert himself. His doctor diagnoses him with chronic bronchitis, an obstructive lung disease. The smoke from cigarettes has caused inflammation and narrowing of his airways, obstructing the flow of air. Now let's take the case of Mrs. Johnson, a 60-year-old woman who has never smoked in her life but has been feeling increasingly short of breath over the past few months. After a series of tests, her doctor diagnoses her with pulmonary fibrosis, a restrictive lung disease. In her case, the tissues in her lungs have become thick and scarred over time, restricting the lungs from expanding fully. These examples highlight the stark differences between restrictive and obstructive lung diseases, from their causes to their effects on our lungs. Even though they may share some common symptoms, understanding the underlying mechanisms of these diseases is crucial for their diagnosis and management. Understanding these diseases at a deeper level can help us appreciate the importance of maintaining lung health. So let's all take a moment to thank our lungs for the incredible work they do every second of our lives and pledge to take better care of them. So we've covered a lot of ground today about restrictive and obstructive lung diseases. Let's take a moment to breathe in and out as we recap the key points from our discussion. Starting off, we dove into the critical importance of maintaining healthy lungs, our body's very own filtration system tirelessly working to keep us oxygenated and alive. We then ventured into the complex world of lung diseases, specifically restrictive and obstructive types, shedding light on their definitions and causes. Just to jog your memory, restrictive lung diseases such as pulmonary fibrosis or chest wall abnormalities primarily limit the lung's ability to fully expand, reducing lung capacity. On the other hand, obstructive lung diseases, including chronic bronchitis, emphysema, or asthma, mainly affect airflow, creating difficulties with exhalation. From there, we explored how these diseases manifest in our bodies, discussing the common symptoms. Shortness of breath, coughing, wheezing are some of the signs that might hint at the presence of these lung diseases. We also delved into the diagnostic journey, emphasizing how doctors use pulmonary function tests, imaging, and a thorough review of medical history to understand and diagnose these conditions. Next, we address the different strategies for managing these lung diseases. Remember, treatment is not one size fits all. It can range from lifestyle modifications like quitting smoking or improving diet, to medications, to pulmonary rehabilitation. Regular checkups with healthcare professionals are also paramount to monitor the disease's progression and adjust the treatment plan accordingly. Lastly, we brought these diseases to life, visually representing the differences between restrictive and obstructive lung diseases. The animations and diagrams, along with real-life examples, aim to enrich your understanding by providing a more tangible perspective. But here's the thing. These diseases, as complex and intimidating as they may sound, can be managed effectively with early detection and proper treatment. This is why it's so important to be aware of our respiratory health. Never brush off any respiratory symptoms as just a bad day or a little tiredness. If you're experiencing persistent coughing, wheezing, or shortness of breath, it's time to consult with a healthcare professional. Don't shy away from seeking help, as early detection can drastically improve the prognosis and quality of life for those living with lung diseases. So let's keep our lungs happy and healthy, shall we? Let's commit to being proactive about our respiratory health, staying informed, and not hesitating to seek help when needed, because at the end of the day, every breath we take is a testament to the resilience and strength of our remarkable lungs. Remember, early detection and proper management are crucial in dealing with any lung disease. So never ignore any respiratory symptoms and always consult with a healthcare professional.